is Chelsea. I'm a doctor of physical therapy with Renew PT, and today's video is the first in a series of the top 5 reasons you should come see a pelvic floor physical therapist. So if you watched my intro video, I outlined the most common reasons that ladies will come into PT. So today we're going to talk about something called stress incontinence. And stress incontinence is the involuntary leakage of urine whenever you have physical activity. So that just means that you are leaking pee whenever you are not intending to go to the bathroom. So this is typically if you are getting a little leak whenever you're coughing, sneezing. It could be jumping, running, lifting, bending over. Anything that's going to put pressure through that pelvic floor and your pelvis can lead to that stress incontinence if you're having those issues. So that can happen when the pelvic floor is weakened, and there are several different reasons why that pelvic floor can get weakened. So a common one that I'll see is stress incontinence, or that involuntary leakage of urine happening after someone has been pregnant and given birth. It can develop in pregnancy because you have the weight of the baby and the placenta and the fluid, everything that's kind of pushing down on that pelvic floor, and those muscles just can't overcome that stress that's being put through them. So during pregnancy is a really common time that we see it develop. Also postpartum. So if you've birthed your baby, those with a vaginal birth, those muscles get really overstretched and therefore they get weakened. But it can also happen with a C-section birth too. It just puts a lot of pressure on that core and pelvic floor, which can lead to the stress incontinence. Another time that we see stress incontinence is worsening with age. So this would be like the general aging process can cause issues with muscle mass, and it's just harder to either build muscle, and you actually start to lose muscle mass as you age. And your pelvic floor is just another group of muscles like any other muscle in your body. And so with age and with time, those muscles lose their elasticity and their strength and can cause them to not work very well or as well as they used to. Stress incontinence occurs whenever your pelvic floor and the other muscles around your bladder cannot hold back against the pressure that occurs downward through that area. So I've got my model of my pelvis. So I took the organs out so you can just see exactly what's going on internally there. So you'll notice that here's the front of our pelvis, here's the back of the pelvis here, your tailbone is right there. So you'll notice that there's just this big group of muscles that have to contract to hold everything up. So there's also muscles around your urethra that contract to help keep that urine in. And your urethra is just the area where the urine exits. So whenever that becomes weak or damaged, or the aging process just makes that weaker, that's whenever you can get that stress incontinence. So it's not necessarily stress like you're stressed out at work or your family life is stressing you. It's more of a physical stress. So it's like a force that comes through that pelvic floor that leads to that leakage. So a way that physical therapy can help is we are the muscle people. So we help you learn how to appropriately strengthen those muscles, and we do a full evaluation to see where you're the weakest and how we can isolate certain muscles, as well as how we can get them all to work together, and also just teach you some different strategies to help manage that pressure and minimize how much force is going through that pelvic floor to help you with that stress incontinence or with that leakage. So we talked about pregnancy, childbirth, and aging. Another one that can produce incontinence is being overweight. So maintaining a healthy weight can actually reduce the amount of pressure that's going through your pelvic floor and can lead to a decrease in the incontinence or a decrease in the leakage that you're noticing involuntarily. So what we look for in the clinic, if you are coming in for stress incontinence or that leaking whenever you jump and run and cough and sneeze. So first of all, what we'll just kind of talk to you about your daily activities. So someone who sits at a desk all day may have different demands than somebody who works out on a farm and is lifting hay bales or, doing heavy labor essentially. So we will talk about kind of what your typical day looks like, how active you are, whether you do exercise quite a bit, or basically when you notice your leakage the most. Is it more whenever your bladder is really full? Does it not have to be a full bladder? Can it just be with the first cough? Does it take you several coughs before you start to notice leakage? Do you find yourself, trying to squeeze everything in and hold everything in every time you sneeze? So we'll really talk about the history of what you've been feeling and how severe that you feel like your leakage is. We also will ask about use of feminine hygiene products. So are you using any incontinence pads or panty liners throughout the day? Do you need Depends? How severe is that leakage? How many pads are you going through throughout the day? And that just kind of gives us an estimate and helps us set goals, because ultimately we want to get you to where you're not having to use any of those. They're expensive and they can be uncomfortable. So the goal would be to strengthen that area enough to where you don't need those devices. After we talk about your history with your condition and just kind of how you've been managing it so far, we'll also take a look at your whole body. So how you breathe, how strong you are through your core, how your lower back moves. We'll also look at your pelvic floor strength, and we can check that internally and externally, so inside and just from the outside, just to get an idea of how you can contract those muscles, and do you have any control? Can you control it? So once your therapist gets a good idea about how you're using your muscles, how everything is functioning with your pelvic floor and with your core, that's when we can start to work together to come up with a treatment plan. So we will look at what are your goals? What would you like to be able to do? Do you want, complete resolution of this incontinence whenever you're coughing and sneezing? Usually the answer is yes. People don't enjoy peeing on themselves. So that's definitely something that we will set goals to get you away from. So a lot of times in our treatments, we'll work on strengthening. It can be working on breathing, and basically just, working on modifying the activities that you're doing, or changing those activities that you're doing to where it's not putting as much pressure through your pelvic floor. Stress incontinence is something that so many women live with. It is something that you hear moms all the time saying, well, I had a baby, so, I'm just going to pee on myself for the rest of my life. And, there's jokes made about it, and it really shouldn't be something that you joke about, because it can be helped. There's lots of different treatment options out there, and physical therapy is a great first line treatment. It's conservative, meaning it's not extremely invasive. And it's something that really empowers you to take charge and to be able to help fix it on your own. I've treated so many women that are so happy that they have gone through a course of physical therapy, and they are shocked about the difference that it makes. And just sitting around and doing Kegels sometimes doesn't cut it. We have to look at your whole body and how it works together. It might be an issue with your core strength. I've seen women who have really strong pelvic floors, but they are really weak through their core, and they're still getting leakage whenever they cough and sneeze. So we can just make some little modifications like that. So everybody's treatment looks a little bit different, but all with the same goal of helping stop that leakage whenever you cough and sneeze. So if you're somebody that is suffering from urinary incontinence, specifically stress incontinence, or leaking whenever you cough and sneeze, please reach out to a pelvic floor physical therapist, someone who is trained in disorders of your pelvic floor, and someone that can help you get back on the right track. Just because you've had a baby doesn't mean that you have to live with stress incontinence. You are not doomed to a life of wearing pads and panty liners for the rest of your life. So please feel free to drop any questions that you have in the comment section. I'll try my best to answer them, and I appreciate you watching. Thank you.